Okay guys, so just to continue ang ato ang discussion sa enzymes, let me just move forward to alkaline phosphatase. Hold on. Okay, here we go. So alkaline phosphatase, also known as our ALP, their functions the function is to liberate inorganic phosphate from an organic phosphate ester with the concomitant production of an alcohol. So ang activator niya is magnesium. Okay, so for the tissue sources, we have several. We have highest concentrations the intestine, liver, bone, placenta, spleen, and kidney. Sa liver, it is concentrated sa sinusoidal or sa canalicular membrane. And then sa bone is confined to the osteoblasts. So in terms of its diagnostic significance, we have um, first the hepatobiliary disorders. So the elevations are more predominant in obstructive more than the hepatocellular disorders, and we also have biliary obstructions wherein our ALP levels would reach 3 to 10 times the upper limit of normal. Okay, increases are primarily as a result of increased synthesis of the enzyme induced by the decrease or block flow of bile or cholestasis. And then we have hepatocellular disorders such as our hepatitis or cirrhosis. And then level of increase niya would be less than 3 times the upper limit of normal. We also have our bone disorders, whose elevations are observed when there is involvement of osteoblasts. Next, we have Paget's disease or osteitis deformans. So this is where we can observe the highest elevation of our ALP activity. And we also have other bone disorders such as osteomalacia, rickets, hyperparathyroidism, or osteogenic sarcoma. Okay, you can find that's a book. And then other causes of elevation would be healing bone fractures and periods of physiologic bone growth. So these other causes of elevation are non-pathogenic, but we can observe an elevation in ALP during these events as well. Okay, we can also see an elevation sa atong ALP during pregnancy because diba we can find ALP sa placenta. So naga-increase siya 1.5 the upper limit of normal detected between 16 to 20 weeks, and then during the third trimester, maabot siya up to 2 to 3 times the upper limit of normal. It increases and persists until the onset of labor, and then after ni mamanganak, after like 3 to 6 days, it will return to normal. Now we can see a decrease during hypophosphatasia and a subnormal level during the absence of bone isoenzyme, in which case nag-result siya in inadequate bone calcification. Next, we have several isoenzymes sa ato ang ALP. Primarily, we have four major isoenzymes. First, we have the liver. So your liver isoenzyme has two fractions. You have the major liver band and the alpha 1 liver, which is the smaller na fraction. The alpha 1 liver, okay, migrates anodal to the major band and corresponds to the alpha 1 fraction of protein electrophoresis. So this is reported usually in cases of metastatic carcinoma of the liver and other hepatobiliary diseases. This is also regarded as a valuable indicator of obstructive liver disease. For our major band, so when total ALP levels are increased and mao na siya nagka-comprise sa majority of the liver fraction. Okay. Next isoenzyme, we have the bone isoenzyme. So this increases due to osteoblastic activity and normally elevated during periods of growth and for adults older than 50. So no further explanation given to book for the placenta isoenzyme. So I guess like it was mentioned earlier, nagasaka lang siya from 1.5 up to 3 times the upper limit of normal during pregnancy. So for the intestine or intestinal isoenzyme, so the presence depends upon the blood group and secretor status of the individual. So ang mga secretor na to would be the group B and group O na blood group, and they are most likely to have the fraction of intestinal na isoenzyme. Okay. And they usually have increased levels of ALP after meals, which reaches up to 30 IU per liter. So our group A also has ALP, but it is bound by erythrocytes. We also have increased levels in other conditions, such as diseases of the digestive tract and also cirrhosis. Okay, so next we have abnormal fractions, also known as your carcinoplacental alkaline phosphatase. So they are called carcinoplacental because they are similar to placental isoenzymes. The frequency of occurrence ranges from 3 to 15% in cancer patients. First, we have your Reagan isoenzyme. It is characterized as an example of an ectopic production of an enzyme, which can be observed in a malignant tissue and then detected siya in various carcinoma, such as your lung, breast, ovarian, colon, and usually it presents the highest incidence for ovarian and gynecologic na mga carcinoma. It is useful in monitoring the effects of therapy because it will disappear on successful treatment. It also migrates to the same position as the bone fraction and considered to be the most heat stable of all ALP isoenzymes because just like your placental na isoenzyme, it resists denaturation at 65 degrees Celsius for 30 minutes. And your Reagan isoenzyme is inhibited by your phenylalanine. Okay, next we have your Nagao isoenzyme. This is considered to be a variant of Reagan isoenzyme. Almost the same properties as your Reagan isoenzyme. Additional lang na nag-inhibit sa Nagao is ilucin. Okay. And the presence of your Nagao isoenzyme is indicated for metastatic carcinoma of pleural surfaces and adenocarcinoma of pancreas and the bile duct. Okay, for the assay for enzyme activity, okay, Bowers and McComb conducted or sila ang nag-develop sa continuous monitoring technique that allows calculation of ALP based on the molar absorptivity of P-nitrophenol. Okay, we have several techniques that can be used to determine also your ALP plasma activities, such as separation of the isoenzymes by electrophoresis. So your electrophoresis is considered as the most single technique for distinguishing between ALP isoenzymes. Okay, so if we want to locate or not locate but identify jud ang mga isoenzymes, very useful gihapon ang electrophoresis. Okay, so in terms of the rate of migration, first we have fastest will be the liver, and then the bone, and then the placental, and then the last will be the intestinal. Okay, but there is no clear separation between the liver and the bone phosphatases. Okay, we also have the stability by inactivation by heat or chemicals. So For the liver isoenzyme, it is more heat stable than bone. Your bone isoenzyme is inactivated at 56 degrees Celsius for 10 minutes, and during this time, the liver isoenzyme will remain stable. The bone is considered to be the most heat labile, and the placental is considered to be the most heat stable. Next subplacental would be the intestinal, and then the liver isoenzyme, and then the last would be the bone isoenzyme. Okay. We also have the sensitivity to various inhibitors such as your phenylalanine, which inhibits intestinal and placental ALP to a greater extent than the liver and bone ALP. We also have affinity to specific lectins and immunochemical assays developed usually for the measurement of bone-related ALP, but then it lacks the specificity for the bone isoenzyme. For your sources of error sa ALP determination, we have hemolysis. So any level of hemolysis, because your ALP is 6 times more concentrated in RBC than serum. Okay. Also, we have delay in processing. So activity in serum increases 3 to 10% on standing at 25 degrees Celsius or 4 degrees Celsius for several hours. So we have to test immediately gihapon ang ato ang blood or serum for ALP. Next, we have the diet, which induces elevations for your secretors, blood group B or O, and can cause 25% higher, especially if following the ingestion of high fat meal. And then for your reference range, we have here, according to gender, we have for the males and females, and this would be also according to age because the pag more than 50 years old na medyo mo um, dako-dako na pud ang ano, levels, and also during puberty or nag-grow ang bone, 'di ba? So makita ninyo diri na medyo dako pud kaayo ang or taas pud ang level of your ALP. Next, we have your acid phosphatases or your ACP. It belongs to the same group of phosphatase enzymes as ALP and is a hydrolase that catalyzes the same type of reaction. Okay, a major difference lang sa atong acid phosphatase with the ALP is the pH of the reaction. So for our acid phosphatase, okay, we need to stabilize the reaction by acidification to a pH of less than 6.5 with the optimal pH of 5.0. Tissue sources for our acid phosphatase, we have here prostate, which is the richest source. It can also be found sa ato ang bone, liver, spleen, kidney, RBC, and platelets. So we have a lot of sources as well sa ato ang acid phosphatase. For your diagnostic significance, so it is useful in the detection of prostatic carcinoma, particularly the metastatic carcinoma of the prostate. We have elevated ACP levels only detected when prostatic carcinoma has already metastasized. So, kung wala pa nag-metastasize or nag-spread ang kanang carcinoma, hindi pa kayo ma-detect ang ACP or elevated ACP levels. So, which is why a more useful the screening and diagnostic tool would be your tumor marker, the PSA, which is more likely to be elevated at each stage of prostatic carcinoma. However, it is particularly useful to monitor the success of treatment. Okay. And then we have other sources of your ACP level elevation. We have, Shepard already mentioned, prostatic carcinoma. We have bone disease, which is the tartrate resistant form of your ACP. We have breast cancer, Paget's disease, breast cancer with bone metastasis, Gaucher's disease, and platelet damage. okay, such as in the case of idiopathic thrombocytopenic purpura, wherein there's thrombocytopenia resulting from excessive platelet destruction. Okay. In the case of forensic clinical chemistry, your acid phosphatase is also useful in the investigation of rape cases. So, vaginal washings are examined for seminal fluid ACP activities, which usually lasts or persists up to 4 days. So, any elevated activity is presumptive evidence for rape. Okay. So for the assay for enzyme activity, so it uses the same technique as ALP, but usually performed at an acidic pH. Okay, and for your immunochemical techniques, we can perform either ELISA or immunoselective enzyme immunoassay, or your ICEA. Okay, for sources of error, plasma should be separated from red cells to prevent the leakage of your acid phosphatase from RBC and platelets, and also hemolysis can cause contamination from the ACP. Pinag-decrease ang activity niya within 1 to 2 hours if left at room temperature, so it should be frozen or acidified to a pH lower than 6.5, and then it will remain stable for 2 days at room temp, 1 week at 4 degrees Celsius, and then 4 months at negative 20 degrees Celsius. For your reference range, you have if it's prostatic ACP, reference range niya would be 0.5 ngml. If it's total ACP for adults and children, we have 1.5 to 4.5 and 3.5 to 9.5 respectively. And now we have your gamma glutamyl transferase. So it belongs to it involves the maintenance of tissue na sorry, I think din ako siya ako siya na-move. Okay. For the transport of amino acid across cell membrane. So, your glutathione, sorry, kulang siya sa H, it serves as a glutamyl donor. Okay. And then, for the tissue source, highest concentration is found sa kidney, but it can also be found sa brain, prostate, pancreas, and liver. As you can remember, one of the enzymes that we test for liver function, 'di ba, is your GGT. Aside from GGT, we also have your AST, ALT, and lactate dehydrogenase, 5-nucleotidase, and also your ALP. Okay. But the highest concentration of your gamma glutamyl transferase is actually sa inyong kidney, and the clinical application are confined to the liver and biliary system. Sorry, this is transferase. For your diagnostic significance, sa liver, your GGT is located in the canaliculi of the hepatic cells, particularly sa epithelial cells lining the biliary ductules. So GGT is elevated in all hepatobiliary disorders. However, there is a higher elevation na observed sa biliary tract obstruction, which would usually cause 5 to 30% increase in the 5 to 30 times the upper limit of normal. Under sa hepatic parenchyma, so GGT is elevated in patients receiving enzyme-inducing drugs, which causes an increase of 4 times the upper limit of normal. These enzyme-inducing drugs could be warfarin, phenobarbital, phenytoin, or high alcohol consumption. Or phenytoin. And then we have high alcohol consumption, particularly chronic alcoholism, which causes an elevation of 2 to 3 times the upper limit of normal. So the assays for sa GGT are useful in monitoring the effects of abstentions. Pag mag-abstain ang mga chronic alcoholic from alcohol, So ginagamit nila ang GGT as a useful form of monitoring. Okay, because usually it returns to normal levels 2 to 3 weeks after the cessation of or from abstaining from drinking alcohol. Okay, other conditions where we can see an increase ato on GGT would be your acute pancreatitis, diabetes mellitus, and also your myocardial infarction. Okay, it is useful also in differentiating the source of elevated plasma ALP level because since taas kayo ato ang ALP levels sa skeletal disorders and pregnancy, ang ato ang GGT will remain normal. Okay, so for storage as a source of error, activity is stable with no loss of activity if stored at 4 degrees Celsius for 1 week. So improper storage would cause loss of activity. Hemolysis does not interfere with GGT levels because the enzyme GGT is not found in erythrocytes. So even if ma-hemolyze ang sample, it would not cause an increase sa ato ang GGT. Reference range, males have 6 to 55 UL and then female 5 to 38 UL, and usually lower siya in females because of suppression of enzyme activity resulting from estrogenic or progestational hormones. Next, you have your 5-nucleotidase, which requires a divalent cofactor thought to be zinc. Okay. So, tissue source, it is usually primarily bound to plasma membrane within the cell and useful in the diagnosis of hepatobiliary disorders as well. For the diagnostic significance, so makita na to ang increase during hepatobiliary disease. So highly specific ang 5NT na to for the um, hepatobiliary na disease. So increased plasma levels of 5NT are almost always an indication na naatay disease sa hepatobiliary na part sa liver. Okay, and then it can also be used to differentiate ang cause of your ALP because sa skeletal and bone disorders, it is usually normal to only slightly elevated. But nag-increase po siya during the second and third trimester of pregnancy, but only a slight increase. We also have our sources of error for our 5NT. High concentrations of nonspecific phosphatases can cause falsely elevated results, and EDDA will usually inhibit enzyme activity and likely due to the chelation of zinc. Okay, so maybe makakause siya falsely low na results. Reference range na to for your 5NT would be 3 to 9 U per L. Okay, so that is it for the um, next four na mga ng mga enzymes na to. And then afterwards, I will be sending also the last few enzymes after this one. And then we will be having the quiz on Friday at 2:30. However, the one that will be assigned to administer the quiz would be Doc Clyde. Because of the CHED visit, all the full-time faculty are required to just be present lang at any time in case natawagon me. So, instead of um, putting it off, fortunately, Doc Clyde is available to administer the quiz because last na put na to na meeting would be kana na time. Okay, so do study. If there are any missing information or information that I have not placed here sa PowerPoint, you can always find it sa libro. Okay, the ones I placed sa PowerPoints I just need to know, but further details and explanations, especially sa kanang assays and clinical significance would be found sa inyuhang libro sa Bishop. Okay, so thank you so much for listening. Good night.